Once one enters the world of a cancer diagnosis, the term lymph node tends to pop into conversation. So, what is a lymph node? What does it do? And why is it so important to you and your cancer team? I'm cancer physical therapy specialist, Dr. Leslie Waltke. Welcome to the recovery room, where today we're going into the classroom to talk about lymph nodes. So let's start with what a lymph node is. Lymph nodes are part of our lymphatic system. There are approximately 600 lymph nodes in the average human body. Now, they are located in groups or chains. There's a group in the neck, there's a group in the underarm, groups in the chest, in the abdomen, the groin, wait for it, and even in the back of the knee. Lymph nodes are small structures, typically about 1 centimeter in size, in the shape of a typical kidney bean. In this context of cancer, we're going to talk about lymph nodes as filters. Now, though they are all structurally about the same, we name them by their location. So if they are found above the clavicle, we call them the supraclavicular lymph nodes. The official name for the underarm is the axilla. So these are our axillary lymph nodes. In our chest, we have hilar lymph nodes and mediastinal lymph nodes. In the abdomen, we have aortic lymph nodes. And in the groin, we call them inguinal lymph nodes. We often also name lymph nodes by where they're found in their particular chain. So you may have a level 1 lymph node, a level 2 lymph node, a level 3 or level 4 lymph node. Sometimes you will also hear them called sentinel lymph nodes, which means they are the first 1 or 2 or 3 lymph nodes that drain that particular chain. Now let's talk about what do our lymph nodes do. They do a lot of really cool different things, but in this context, we're going to be talking about lymph nodes as filters. So as all the fluid comes back to the center of our body, into our heart and our lungs, it all gets filtered through our lymph nodes. And the lymph nodes pull out anything that's not supposed to be there. Broken cells, waste products, bacteria, and cancer cells. So if your cancer surgeon, medical oncologist, or radiation oncologist need to know if the cancer may have spread beyond its original location, one of the best places to find out is by looking in the lymph nodes. Now, unfortunately, we have to take them out to put them underneath the microscope so the pathologist can look to see if there are cancer cells in there. They will then determine how many cancer cells are in there and how many lymph nodes that were removed have cancer in them. Your cancer care team then uses that information to determine if you need surgery, how much surgery, if you need radiation and or chemotherapy, or what kind or how much. So it's an incredibly important diagnostic tool for you and your cancer team to make sure that you are getting the best and most accurate care for your particular disease. Now, unfortunately, removing lymph nodes can have some side effects, and we will talk about those side effects, including pain, cording, and lymphedema, coming up in further installments of the recovery room. But now, my friends, sleep well knowing that you know what a lymph node is, because you know what? It's important. I'm Dr. Leslie Waltke, signing out from the recovery room. And now that you know about lymph nodes, consider yourself a lymph node guru. We'll talk again soon.